A 28 years old man present with right upper quadrant pain. This is the right upper quadrant pain, and Hydatid disease is suspected. Which of the following statement relating to the disease is untrue? That means which is false regarding the Hydatid disease. Here the options. First option, first line treatment with pentavalent antimony. Peritoneal contamination with active daughter cyst may complicate during the surgery. CT scanning of the liver may show a floating membrane. Biliary communication with cyst may occur. It is caused by the Echinococcus granulosus. So what may be the answering option? First of all, let's see details about the Hydatid disease. Here we can see this is the Hydatid cyst. There, this is one Hydatid cyst, another Hydatid cyst, another, and this wall cyst together with bound with another cyst wall, and this cyst wall is removed. That means the Hydatid cysts, they are present like this, and they all are covered by another main membrane, and each of the cyst is known as the daughter cyst. So Hydatid cysts, they are multiple, huge in number, and they are covered by membrane. So the Hydatid cysts are endemic in the Mediterranean and also in the Middle East area. Why these two countries is very common, let's see later. And this is commonly caused by an organism which is the Echinococcus granulosus. So Echinococcus granulosus, it is responsible for development of the Hydatid cyst, and this cyst has two capsule. One is the outer fibrous capsule, and this outer fibrous capsule, it contains multiple small daughter cysts, which is shown before. That means the multiple cysts, and these cysts are covered by outer fibrous capsule. These cysts are allergic, which precipitate type 1 hypersensitivity reaction. That means the fluid within the cyst, they can causes hypersensitivity reaction, which is the type 1 hypersensitivity, and when they rupture and goes to the blood, it causes anaphylactic shock. Up to 90% of the cyst occurs in the liver and lungs, and mostly they are in the liver. So Hydatid cysts, they are commonly found in the liver, but they can be found other organ, including the liver, including the spleen and other organ. And it can be asymptomatic or sometimes become symptomatic when cyst is more than 5 centimeter in diameter. And what are the morbidity depends? Morbidity caused, that means the hazard of the patient. Here we can see the cyst busting. If the cyst bursts some reason, so the cystic fluid, it goes to blood and causes the anaphylactic reaction. Also infection, when the cyst is infected, it also cause increased morbidity of the patient. And also the organ dysfunction, such as in the biliary channel, if they block the biliary channel, or in the bronchial area, that means it block the bronchi, also the renal and cerebrospinal fluid outflow obstruction. So when the cyst causes obstruction by direct or indirect, in this cause morbidity of the patient is increased. Here we can see these are the daughter cysts. Each of the cysts are daughter cysts, and they are covered within this outer membrane. This is the membrane, and within the membrane all the daughter cell present here. So what occurs in case of the biliary rupture? That means the Hydatid cyst rupture in the biliary area. So what occurs? It causes the biliary colic, that means pain in the right upper abdomen, also causes jaundice and urticaria. Urticaria due to type 1 hypersensitivity reaction. And how we can diagnose? First of all, we can diagnose CT scan is one of the best option, and we can see the Hydatid cyst present from the amoebic and pyogenic cyst. So in the CT scan, first of all, we can diagnose the Hydatid cyst. We can differentiate, is it Hydatid cyst or pyogenic cyst or amoebic cyst. And surgery is the main stay of the treatment. That means when there is a cyst, that means Hydatid cyst, the first option is to remove the cyst. Cyst wall must not be ruptured during removal, and content sterilized first. That means the content of the cyst or fluid of the cyst, the content of the cyst or fluid of the cyst it should not go to the blood circulation, because there is every chance of development of the type 1 hypersensitivity reaction, which causes anaphylactic shock and even death of the patient. So we have to try remove the cyst with the cyst wall, and we have to be worried not mix of the cystic fluid with the body fluid. Here in this is the CT scan, and in the CT scan here we can see this is the cyst wall, which is the outer part, it is the cyst wall, and inside this here we can see there is one daughter cell, there is another daughter cell, another daughter cell, another daughter cell. So multiple daughter cell present within this hypodense area, and this is the diagnostic feature for the diagnosis factor for the hydatid cyst. So what is our answer? Now see the explanation. First line treatment is the pentavalent antibody. It is not true, because we know the first line treatment is the surgery. So surgery is the first line treatment of the hydatid cyst. So it is not the true option, that means it is the false option. Other options here, such as here we can see this is the peritoneal contamination in active daughter cyst may complicate surgery, even complicate the life of the patient. The patient may die due to hypersensitivity reaction. And CT scan of the liver may show floating membrane. It is also true, because here we can see this is the floating membrane, that means the wall of the daughter cyst, they acts like a floating membrane. So it is also true. Biliary communication with the cyst may occur, sometimes may occur biliary communication, and in this causes the jaundice, right, hypochondric pain, even the urticaria, and it is caused by the Echinococcus granulosus, which is an organism. So the rest of the 4 are true. That means the peritoneal contamination with active daughter cyst may complicate surgery. Yes, they complicate surgery. That means anaphylactic reaction within the table and may cause death of the patient. CT scanning of the liver may show floating membrane. It is also true, because the membrane floating, which is the membrane of the daughter cyst, and biliary complication with the cyst may occur. It is also true, and it is caused by Echinococcus granulosa. It is also true. And only false option is the first line treatment is the pentavalent antibody. It is not true, because here we can see the cyst present and they are covered by a membrane or fibrous membrane. So it is not possible to penetrate the fibrous capsule by the pentavalent antibody. So the pentavalent antibody actually it has no role, because it cannot penetrate the wall of the hydatid cyst. So here pentavalent antibody no role. Here the surgery is the mainstream of the treatment, and during the surgery we should remove the cyst with its content, and we should prevent the contamination of the fluid with the body fluid. Thank you all.